Cayley, good morning, and thank you very much for your time. Just before we get into discussing some of the facts that you've been checking currently, just how does Africa Check go about its business? I mean, your business is to make sure that what is pronounced out there is in fact factual and accurate.
So Africa Check is one of the continent's first leading independent fact-checking organizations, and the bulk of our work is really looking at claims that are made in the public domain, be it by politicians, public figures, media personalities, and verifying whether what they say is true or not. Of course, we also are looking at a lot of things happening on social media, particularly in the time of coronavirus. We've been almost inundated with messages from people asking about confirmed cases, asking us about cures and preventative measures. So we've been looking at some of the things that we've been sent and trying to make sure that people have access to the correct information at this time.
Yes, and that people are getting it from reliable and trustworthy sources. Okay, there are a couple of facts. I've had some of these myself from various people, and sometimes when people state these either via WhatsApp or Facebook or Twitter, they state them like it's a fact. Let's start with the first one. There's a claim that gargling with salt water can cure COVID-19. What did you find, true or not?
So we've actually seen variations of this claim during the rounds on social media. For example, the World Health Organization actually debunked a similar claim a few weeks ago that saline spray, which is also a saltwater solution, would cure the coronavirus. It's simply not true. With this claim, it was a little bit deeper than that. It said that before the COVID-19 disease reaches your lungs, it actually stays in your throat for 4 days. And at this stage, you might be able to actually cure the coronavirus by gargling with salt water or vinegar water. Again, it's simply not true. The World Health Organization has said that home remedies like this can sometimes relieve you of symptoms. They sometimes make you feel a little bit better, but they shouldn't be taken as a treatment on their own.
Okay, and another claim is that African skin is resistant to coronavirus.
Yes, so this may seem like a bit of an odd one, but I think there's been a lot of interest in the way that the virus is spreading, and a lot of speculation as to why initially coronavirus didn't spread in Africa as fast as people thought it would, or to the extent that people thought it would. And I think that misinformation like this almost plays on that, because now we're seeing claims that African skin is somehow resistant to the coronavirus. And this comes from an article that was posted on Facebook. Basically, the story goes that there was a young Cameroonian student who was admitted to hospital in China after contracting the virus, but then miraculously recovered, and he was released. And the doctors who worked with him put this down to the fact that he had African skin, and he had a single blood genetic composition which made him resistant to the virus. Again, it's just not true. There's decades of research which shows that African people actually have some of the most diverse genetics in the world, and we can't really have something that's just ours that makes us resistant to the virus. So again, that's a false piece of information.
Yeah, we can see the numbers rising here in South Africa. We can testify to that. Now, finally, another claim that goes around is that Dettol can kill the virus.
Yes, this was doing the rounds prolifically on WhatsApp in the form of a picture, and you can actually see the back of a Dettol product where the label says that, Dettol can kill a number of different bacteria like E. coli, but it can also kill viruses like the coronavirus. I think what's important to remember here is that the coronavirus is not new. It's been around since at least the 1960s, and it's a family of viruses. But pretty much as soon as this picture started doing the rounds, Dettol released a statement saying that, yes, previous products have proven to be effective against some strains of the coronavirus, but health officials have not made this latest strain available to them for testing. So they can't actually say whether their products are effective against the COVID-19 version.
Yeah, because this is a new coronavirus. I mean, you just as you conclude, Cayley, you've got, as Africa Check, I mean, you've got all kinds of categories where you're fast checking around the coronavirus. I mean, there's conspiracy theories, there's like now we've discussed some of the claims about cures and stuff, and there's lots of hoaxes and odd and bizarre things that are happening and broadly contributing to this huge surge of misinformation.
Yeah, so we are really trying to, we've made all of our fact checks available in a live guide so that people can always access it, and we've categorized it, as you've said, according to the different themes that we're picking up on. And I think that it's important to be able to access this information. If you're not getting it from a source like Africa Check, it needs to be coming from, the World Health Organization, the NICD, the Department of Health. And I also always say that Googling is quite helpful. So if you see something that you think is a little bit suspicious, Google it, because you'll often find some extra information there. And if all else fails, I think ultimately just don't share. It's it's understandable why people are a little bit concerned. We're trying to find out as much information as we can and share what we can with our family and our friends. If you're not 100% sure, then it's best just to not press that send button.
Yeah, what's the Africa Check website?
It's africacheck.org, and also on Twitter @AfricaCheck.
Thank you very much, Cayley, for your time this morning from Africa Check.